JEMScN Nursing Mocktest 9 Part A. The sinoatrial node, known as the heart's natural pacemaker, is located in the wall of the options are A. Left atrium, B. Right atrium, C. Left ventricle, D. Right ventricle. So the correct answer is B. Right atrium. Next, number 2, physiology. What is the primary function of surfactant in the alveoli of the lungs? Options are A. To transport oxygen, B. To fight infection, C. To prevent alveolar collapse by reducing surface tension, and D. To warm the inhaled air. So the correct answer is C. To prevent alveolar collapse by reducing surface tension. Number 3, sociology. A family unit consisting of a pair of adults and their children is defined as a. Options are A. Joint family, B. Extended family, C. Nuclear family, and D. Blended family. So the correct answer is C. Nuclear family. Next, number 4, psychology. According to Sigmund Freud, which defense mechanism involves attributing one's own unacceptable thoughts or feelings to another person? Options are A. Denial, B. Sublimation, C. Rationalization, and D. Projection. So the correct answer is D. Projection. Next, 5, microbiology. The Jale-Nielsen staining technique is specifically used to identify. Options are A. Spirochetes, option B. gram-negative bacteria, C. acid-fast bacilli, example Mycobacterium tuberculosis, and D. fungi. So the correct answer is C. Next, number 6, pathology. The pathological death of one or more cells or a portion of tissue or organ resulting from irreversible damage is called. Options are A. apoptosis, B. necrosis, C. atrophy, and D. autophagy. So the correct answer is B. necrosis. Next, number 7, pharmacology. Heparin exerts its anticoagulant effect by enhancing the activity of. Options are A. vitamin K, B. thrombin, C. antithrombin 3, and D. plasminogen. So the correct answer is antithrombin 3. Next, 8, genetics. Down syndrome is a genetic condition caused by the presence of a full or partial extra copy of. Options are A. chromosome 18, B. chromosome 13, C. the X chromosome, and D. chromosome 21. So the correct answer is D. chromosome 21. 9. Administration. In strategic planning, what does SWOT analysis stand for? Options are A. strategy, work, opportunity, threat, B. strength, weakness, opportunities, threats, C. system, workflow, objectives, timelines, and D. success, willingness, opposition, teamwork. So the correct answer is the C. Option B. Next, number 10, education. A nursing student learning to administer an injection is primarily operating in which domain of learning? Options are A. cognitive, B. affective, C. psychomotor, and D. interpersonal. So the correct answer is C. psychomotor. Next, 11, research and statistics. A study in which neither the participants nor the researchers know who is receiving a particular treatment is called a. Options are A. cohort study, B. case control study, C. single blind study, and D. double blind study. So the correct answer is D. double blind study. Next, number 12, anatomy. Which bone is in the human body does not articulate with any other bone? Options are A. patella, B. vomer, C. hyoid, and D. incus. So the correct answer is B. hyoid. Next, 13, psychology. The glomerular filtration rate is a key indicator of the function of which organ. Options are A. Liver, B. Lungs, C. Heart, and D. Kidneys. So the correct answer is D. Kidneys. Next, number 14, pharmacology. Naloxone is a specific antagonist used to reverse the effects of an overdose from. Options are A. Benzodiazepines, B. Barbiturates, C. Opioids, and D. Amphetamines. So the correct answer is C. Opioids. Next, psychology. In Maslow's hierarchy of needs, the highest level of human motivation is. Options are A. Safety needs, B. Esteem, C. Love and belonging, D. Self actualization. So, the correct answer is the D. Self actualization. Next, number 16, pathology. A detached intravascular solid, liquid, or gaseous mass that is carried by the blood to a site distant from its point of origin is a. Option are A. Thrombus, B. Atheroma, C. Embolus, and D. Aneurysm. So the correct answer is C. Embolus. Next, number 17, genetics. The observable physical or biochemical characteristics of an organism, as determined by both genetic makeup and environmental influences, is its. Options are A. Genotype, B. Phenotype, C. Allele, and D. Karyotype. So the correct answer is B. Phenotype. Number 18, administration. The process of assigning responsibility and authority for accomplishing tasks to another person is known as. Options are A. Supervision, B. Planning, C. Delegation, and D. Organizing. So the correct answer is C. Delegation. Next, number 19, research and statistics. In hypothesis testing, what does a p-value represent? Options are A. The probability that the null hypothesis is true, B. The size of the sample, C. The effect size of the result, and D. The probability of obtaining the observed result assuming the null hypothesis is true. So the correct answer is D. Next, 20, microbiology. An autoclave achieves sterilization by using. Options are A. UV radiation, B. Dry heat, C. Steam under pressure, and D. Ethylene oxide gas. So the correct answer is the C. Steam under pressure. Part B, 21, Foundation of Nursing. A patient experiencing shortness of breath dyspnea should be placed in which position to facilitate breathing? Options are A. Supine position, B. Prone, C. High Fowlers, and D. Trendelenburg. So the correct answer is C. High Fowlers. Next, 22, Foundation of Nursing. The Braden scale is a widely used tool for assessing a patient's risk for. Options are A. Falls, B. Developing pressure ulcer, C. Malnutrition, D. Fluid volume deficit. So the correct answer is B. Developing pressure ulcer. 23, medical surgical nursing. What is the priority nursing intervention for a patient experiencing acute chest pain characteristic of angina pectoris? Options are A. Administer oxygen, B. Administer prescribed sublingual nitroglycerin, C. Obtain a 12-lead ECG, and D. Check vital sign. So the correct answer is B. Administer prescribed sublingual nitroglycerin. 24, medical surgical nursing. A moon face, buffalo hump, and central obesity are classic signs of which endocrine disorder? Options are A. Addison disease, B. Cushing syndrome, C. Graves disease, and D. Hypothyroidism. So the correct answer is B. Cushing syndrome. Next, 25, pediatric nursing. A barking cough is a characteristic sign of which pediatric respiratory condition? Options are A. Asthma, B. Bronchiolitis, C. Croup, laryngotracheobronchitis, and D. Epiglossitis. So the correct answer is C. Croup. 26. Pediatric nursing. What is the primary treatment for Kawasaki disease in the acute phase to prevent coronary artery aneurysms? Options are A. Antibiotics and corticosteroids, B. Intravenous immunoglobulin, IVIG and aspirin, C. Antivirals and bed rest, and D. Diuretics and oxygen therapy. So the correct answer is B. Next, 27. Psychiatric nursing. Wernicke-Korsakoff syndrome is a neurological disorder caused by a deficiency of which vitamin? Commonly seen in chronic alcoholism. Options are A. Vitamin B12 cobalamin, B. Vitamin C ascorbic acid, C. Vitamin B1 thiamine, and D. Vitamin D. Correct answer is vitamin B1 thiamine. Next, 28. Psychiatric nursing. Tardive dyskinesia, characterized by involuntary repetitive body movements, is a potential side effects of long-term use of which class of medication? Options are antidepressants, SSRIs, B. Antipsychotics, C. Mood stabilizer, and D. Benzodiazepines. So the correct answer is B. Antipsychotics. Next, 29. Obstetrical nursing. Nagli's rule is a standard method used to calculate a pregnant woman's. Options are A. Date of quickening, B. Estimated date of delivery, C. Gestational age by ultrasound, and D. Fundal height. So the correct answer is B. Estimated date of delivery. Next, 30. Obstetrical nursing. The most common cause of early postpartum hemorrhage within the first 24 hours is. Options are A. Uterine atony, B. Retained placental fragments, C. Lacerations of the genital tract, and D. Coagulation disorder. Correct answer is A. Uterine atony. Next, 31. Community health nursing. In the context of the national immunization program, what does the term cold chain after to? Options are A. System of storing and transporting vaccines at recommended temperature, B. A list of new vaccines to be introduced, C. A method for tracking vaccine side effect, and D. A community awareness program about vaccine. So the correct answer is option A. Next, 32. Community health nursing. Health screening programs such as mammography for breast cancer are an example of which level of prevention? Options are A. Primary prevention, B. Secondary, C. Tertiary, and D. Primordial. So the correct answer is the B. Secondary prevention. Next, 33. Foundation of nursing. An infection that is acquired by a patient during a hospital stay is known as. Options are A. Community acquired infection, B. Opportunistic infection, C. Nosocomial infection, and D. Iatrogenic infection. So the correct answer is C. Nosocomial infection. 34. Medical surgical nursing. The Glasgow Coma Scale GCS is used to assess a patient's. Options A. Level of consciousness, B. Pupillary response to light, C. Pain level, and D. Motor strengths. Correct answer is A. Next, 35. Pediatric nursing. A significant difference in blood pressure between the upper and lower extremities in an infant may indicate. Options are A. Atrial septal defect, ASD, B. Patent ductus arteriosus, PDA, C. Tetralogy of Fallot, TOF, and D. Coarctation of the aorta, COA. So the correct answer is option D. 36. Psychiatric nursing. Anergia, anhedonia, and avolition are considered what type of symptoms in schizophrenia? Options are A. Positive symptoms, B. Negative, C. Cognitive, and D. Affective. So the correct answer is B. Negative. Next, 37. Obstetrical nursing. HELP syndrome is a life-threatening pregnancy complication usually considered a variant of preeclampsia. What does HELP stand for? Options are A. High blood pressure, edema, low platelets, liver failure, B. Hemolysis, elevated liver enzyme, low platelet count. C. Hyperemesis, elevated leukocytes, low protein. And D. Hemoglobinuria, elevated lipids, low potassium. So the correct answer is B. 38. Community health nursing. The epidemiological triad of disease causation refers to the interaction of options are A. Agent, host, environment. B. Poverty, illiteracy, infection. C. Virus, bacteria, fungus. And D. Primary, secondary, tertiary prevention. So the correct answer is A. Agent, host, environment. Next, 39. Foundation of nursing. According to current guidelines for adult CPR, what is the correct ratio of chest compression to breaths for a single rescuers? Options are A. 15 is to 2, B 30 is to 2, C 15 is to 1, and D 30 is to 1. So the correct answer is B 30 is to 2. Next, 40. Medical surgical nursing. A patient with a perforated peptic ulcer will most likely present with options are A. Dull, gnaawing epigastric pain, B. A sudden, sharp and severe abdominal pain, C. Projectile vomiting, and D. Jaundice. So the correct answer is B. A sudden, sharp and severe abdominal pain. Next, 41. Pediatric nursing. According to Piaget's theory of cognitive development, a toddler 1 to 3 years old is typically in which stage? Options are A. Sensory motor, B. Pre-operational, C. Concrete operational, and D. Formal operational. So the correct answer is A. Sensory motor. Next, 42. Psychiatric nursing. The primary purpose of milieu therapy is to options are A. Administer medications on a strict schedule, B. Use the environment itself as a therapeutic tool, C. Provide deep psychoanalysis, and D. Focus solely on family dynamics. So the correct answer is B. Use the environment itself as a therapeutic tool. Next, 43. Obstetrical nursing. The Apgar score is assessed at 1 minute and 5 minutes after birth to evaluate the newborns. Options are A. Gestational age, B. Risk for genetic disorder, C. Physical condition and need for resuscitation, and D. Bonding with the mother. So the correct answer is C. Next, 44. Community health nursing. What does DOTS, a strategy for controlling tuberculosis, stand for? Options are A. Daily observed treatment short course, B. Directly observed therapy short course, C. Daily oral treatment schedule, and D. Direct ocular test for sight. So the correct answer is B. Next, 45. Foundation of nursing. The normal range for intraocular pressure IOP, which is important in screening for glaucoma, is options are A 2 to 5 mmHg, B 10 to 21 mmHg, C 25 to 35, and D 40 to 50. So the correct answer is B 10 to 21 mmHg. 46. Surgical nursing. The dietary approaches to stop hypertension diet emphasizes the increased intake of options are A. Red meat and processed foods, B. Sodium and saturated fats, C. Fruits, vegetables and low fat dairy, and D. Sugary drinks and refined grains. So the correct answer is the C. Next, 47. Pediatric nursing. Phimosis, a condition sometimes seen in uncircumcised male infants, is the options are A. Inability to retract the foreskin over the glans penis, B. Urethral opening on the ventral side of the penis, B. Absence of one or both testes from the scrotum, and D. Inflammation of the glans penis. So the correct answer is A. Next, 48. Psychiatric nursing. Instability in interpersonal relationship, self-image and mood along with marked impulsivity are key features of which personality disorder? Options are A. Narcissistic personality disorder, B. Antisocial personality disorder, C. Obsessive compulsive personality disorder, and D. Borderline personality disorder. So the correct answer is D. 49. Obstetrical nursing. In the GDPAL system for recording obstetric history, what does the A stand for? Options are A. Abortion, miscarriages, B. Amniocentesis, C. Alive children, and D. Apgar score. So the correct answer is A. Next, 50. Community health nursing. Anganwadi centers are the focal point for the delivery of services under which flagship program of the Government of India. Options are A. National Health Mission, B. Janani Shishu Surakha Karjokram, C. Integrated Child Development Services, and D. Ayushman Bharat. So the correct answer is C. Integrated Child Development Services.